welcome back. Whether it's the mild winter or simply the normal expansion of the range of the tick, Northern Michigan is seeing an uptick in ticks this spring. And before they start to bug you or your family or your pets, making a house call tonight, Dr. LuAnn Labian with the Traverse Area Pediatric and Adolescent Clinic. Welcome back.
Thank you.
Very interesting topic tonight. So I was just reading an article about how, for some reason, we're seeing an uptick in ticks. So first off, there's different kinds of ticks out there.
Absolutely. There's a lot of different kinds, and really the only one that carries Lyme disease is what's called the deer tick.
The deer tick.
Yeah, or sometimes it's called a black-legged tick is also the other one. It's a little bit smaller than most of them.
Okay.
Which is nice because they're all really ugly.
Ooh, that one's ugly.
It's really gross. But, the smaller the size, sometimes the younger ones carry more Lyme. So you have to really look for them. And especially in children, you have to look for them really closely because you have to find them on the skin.
So once this tick's on you, how long does it take to
transmit Lyme? The tick actually has to be attached to the skin for over 36 hours. So it's really important to remember because people call up all the time, really being nervous and scared because they found a tick on their child. And when you live in a Lyme endemic area, I used to live out east, it's really important that when you bring kids in that you just every 24 hours you give them their bath, you do a tick check. You really check behind the neck and behind the ears, the armpits, the groin, between the buttocks. All the little warm places is where the tick will want to get. And if you remove that after they've been out playing, you don't have to worry about Lyme because they're not going to get it. It has to be on the body for 36 hours, so don't skip your bath.
That's right. That's scary because kids might come in and, they don't necessarily check themselves. They don't care.
Right. They don't check themselves. But the nice thing is that most kids, moms and dads, do check them. So sometimes it's harder on adults because you're less likely to have somebody help you with your bath. So when you're 2 years old, 3 years old, 4 years old, you have a parent checking the child, giving the child a bath before they go to bed at night, and you can make sure that those ticks are removed.
Check all those areas.
Yep.
All right, so we're talking about treating them, but what about prevention?
Well, the best way to prevent is to actually wear clothing, long sleeve, long pants. I know it's easier said than done when it's really hot outside.
Exactly, yeah.
But to also if you're out in the woods, tuck your pants in your socks so that they can't crawl up the pant leg because that would be a really common time.
Okay.
The ticks are usually in tall grasses, okay, so you have to be careful about that. You can
That's
use
their hangout.
That's their hangout. You can use some tick repellent. DEET is the most effective. DEET is, if it's less than 30%, it can be safe for children and has been reported safe for children. I personally don't like it under any baby under the age of 2. It's a very strong 2 years of age, even though they say you can use it down to 2 months. But I just don't like using it. You can try something more natural like oil of lemon or eucalyptus.
Okay.
You can. But I think the best way is just to remove them.
Just remove them.
Just remove them.
All right.
So 2-month-old shouldn't be running through the grass, so hopefully that doesn't happen.
So if they see a tick, what's the best way to get that tick out of there?
Yeah, that always freaks people out. They are very ugly. But get a pointed tweezers and you go as close to the skin as you can get. You take the tweezers close to the mouth, the head, right to the skin, and you just pull directly up. Don't use oils, paste, heat, hot, none of that stuff.
Chemicals?
No chemicals. They really don't work. You just really want to pull it out and make sure you don't leave any body parts of the tick in the...
I wouldn't even think they...
No, their mouth is pretty really close to be left in there. So you don't want that to happen. And then you just clean and wash it and then make sure that it doesn't get infected just like any other thing. And they rarely do. Tick bites actually don't leave a big welt like a mosquito bite. They actually don't leave anything. And Lyme disease is going to happen... It's 3 to 21 days, but most often it's about 2 weeks of age or 2 weeks after the bite. It may have a rash somewhere in the region of the bite, but it's not exactly on the bite.
Yeah, it feels like a bullseye.
Yeah, it's flat. It's not raised. It's a bullseye. It's very obvious. It's nothing you're going to miss.
So that's something parents can also look
and if you
for.
see that, you need to get into your doctor.
Get into the doctor.
Get into the doctor.
All right. Well, thank you so much, Dr. Labian. I feel like there's bugs on me now. A little bit. Thank you so much. A lot of interesting tips for us.
All right. Thank you.
Well, if you'd like more information on ticks or the Traverse Area Pediatric and Adolescent Clinic, you can log on to our website at UpNorthLive.com.